Philip undergoes dialysis 3 times a week. Why? Because his kidneys are highly damaged. Healthy kidneys remove waste products and excess water from our blood and secrete these in the urine. They also control blood pressure, blood sugar, and the acidity of our body. But what if our kidneys fail, as for Philip, a patient with chronic kidney disease? In this case, the removal of waste products is massively decreased and waste accumulates in the blood. This damages our organs and makes us sick. At the end stage of chronic kidney disease, dialysis or kidney transplantation is required to replace the failing kidney function. Kidney failure is not rare at all. Worldwide, 10% of people suffer from chronic kidney disease. Within 5.5 years of follow-up, around 70% of these patients will have died. Almost half of these deaths are caused by diseases of the heart and blood vessels, which doctors summarize as cardiovascular disease. Typical examples are heart attack or stroke. Stunningly, chronic kidney disease increases mortality 36-fold in patients below 50 years of age. For dialysis patients in their 30s, the cardiovascular mortality rate is even increased 1,000-fold and is comparable to an 80-year-old person with healthy kidneys. This enormously impacts the CKD patient, but also induces a high socioeconomic burden for all of us. Cardiovascular disease in CKD patients is caused by classical risk factors, like high blood pressure, high lipid levels, and diabetes. But in addition, chronic kidney disease itself is an independent risk factor for cardiovascular disease, and the mechanisms that cause cardiovascular disease in CKD patients differ from those in the general population. This may explain why traditional treatments for cardiovascular disease have largely failed in CKD patients. But how does chronic kidney disease trigger cardiovascular disease? Researchers believe that the accumulation of waste products in CKD patients increases inflammation and oxidative stress in the blood, vessels, and the heart, and thereby enhances cardiovascular risk. The waste products may also trigger vessel calcification, fibrosis, and thrombosis. But how this precisely works is still unknown. We want to understand these mechanisms and want to identify specific products in CKD patients that can predict cardiovascular disease. This should improve the treatment of CKD patients and reduce their risk of cardiovascular failure. In this way, we strive to improve the quality of life for Philip and all other CKD patients.